The one overriding question many people have about the Ebola patient in Dallas is, how was he sent home from the hospital the first time, especially after Presbyterian Hospital doctors said they'd recently had a meeting to prepare for Ebola entering their hospitals. Fox 4's Calvert Collins examines the communication breakdown, which is what is being called the breakdown, and has the ripple effect. Calvert.
Well, Heather, Thomas Eric Duncan first came to this ER on Thursday late at the night, about 10 o'clock. And hospital administrators say at first he did not show any symptoms of the Ebola virus, but now admit that Duncan did tell hospital staff that he had recently been in Liberia and that they discharged him hours later.
That should have triggered the CDC quarantine protocols.
But it didn't. Dr. James Pinkney practices in 2 local emergency rooms, but does not work for Texas Health Resources. Based on what information has been released, he believes more should have been done to isolate Thomas Eric Duncan based on what he told triage staff.
Someone says they've been to West Africa, been to Liberia, a major hot zone. That should have triggered a response. And a mask should have been placed on the patient, gown, gloves, face masks for the ER personnel, and they should have been quarantined.
Texas Health Presbyterian doctors detailed how prepared staff was in case an Ebola patient showed up on their doorstep, arming staff with a checklist of questions to ask new patients weeks ago. Duncan walked into the ER by himself late Thursday night, diagnosed with a low-grade common virus, then sent home with antibiotics.
Regretfully, that information was not fully communicated throughout the full team. And as a result, the full import of that information wasn't factored into the clinical decision-making.
2.5 days later, he returned in an ambulance headed for quarantine as the country's likely first Ebola patient. Because doctors say Duncan was not vomiting nor defecating in his first visit, they don't believe hospital staff was exposed to Ebola. But they're still interviewing employees to see what protective gear they wore while treating him. Dallas County Judge Clay Jenkins wants to reassure the public that just because an Ebola patient is being treated in a Dallas hospital, there is no need to panic.
We don't want to clog up all the emergency rooms. There is no danger to you to use Presbyterian Hospital for your medical needs. This is a great hospital, and there's absolutely zero chance that you can be infected by Ebola.
Now, Dallas County health officials are now monitoring between 12 and 18 people that they believe came into contact with Thomas Eric Duncan. Now, given that he first had symptoms on September 24th, but was not isolated until the 28th, it is possible, doctors say, that he could have potentially exposed those individual people. Hence, that's why they're monitoring them, because they were in close proximity, it's believed from officials, Heather.
All right, so Calvert, the hospital talked an awful lot today about how Duncan was initially handled, but officials stopped short of saying they were wrong.
Well, that's right. No one is coming out, at least from the hospital administration side or the medical side, saying that this was a mistake. But the bottom line is there were supposedly plans in place, as we heard from doctors, to prevent someone with Ebola from being released back into the public. They call it a communication breakdown, pointing out that not all the pertinent information was given to everyone that was initially treating Duncan. The big fact being that obviously he had just come from Africa and disclosed that fact. As of right now, we have not heard if state regulators will be investigating the hospital.
All right, gotcha. Calvert Collins live tonight. Thank you.